Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. We'd like to recognize and acknowledge today is Juneteenth, the acknowledgement of the end of slavery here in the United States. My name is Katie Berg. I'm a research study coordinator at the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing well on Juneteenth.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines submitted through today, June 19th, and we welcome any questions or comments down below or at any of our social media linked in the description. Starting today with a major update on the Ebola outbreak hard hitting in the Democratic Republic of Congo. Dr. Murphy, can you bring us the updates?
Yeah, this is it's kind of a mixed bag right now. So the bad news is that now that they have, three treatment centers set up, they've got treatment all over the place. I mean, at least supportive therapy, and they have the better tests available. They're finding a lot of new patients per day. And these are real numbers. So there's 856 confirmed cases. So this is up from 300, really, when they started testing appropriately. This is already now the third largest Ebola outbreak in history. And it's associated with 198 deaths. So it's bad. Now, in the surrounding countries, we hear mostly from Uganda, which is, relatively stable and they've got resources, so they've got some pretty good reporting. They haven't had a new case since June 5th. So, that's already a couple weeks ago, and that's a very good sign. So if you look at the Ebola epidemic from 2014, the countries that were really hit hard, of course, were Congo, but then it jumped over to West Africa, and you had Liberia, Sierra Leone, and Guinea-Conakry. And those countries were really devastated. They had so many cases. There were cases also in Senegal, Mali, and Nigeria, but similar to what we're seeing in Uganda, they got on top of it right away. If you get it at the beginning, you really have your best chance. This is why the surveillance systems and jumping on things right away is so important. And in Congo, what happened is the Bundibugyo strain, the old test didn't work, and they got delayed a month, and that's why they're in trouble now. So this is something we have to really work on in the future to really stay on top of these. So it's a good sign for the non-Democratic Republic of the Congo countries, but it's a bad sign in Congo. So hopefully they can get that under control, but it's not under control yet.
Yes, thank you for that update. Of course, we will keep a watch on those case numbers and the response as well. But we do have a big COVID study this week with more significant data showing the vaccine is extremely helpful. Can you bring us the numbers, Dr. Murphy?
Yeah, we're really this is getting studied really closely because we've improved our ability to report on these diseases and document the diseases. So this is good. So JAMA Internal Medicine, which is a very respectable journal published here in Chicago, this week it looked at U.S. veteran health data. So the veteran system has always had this centralized database, and they have some really good data there. They also have veterans from all the wars. There's even veterans from World War II, the Korean War, Vietnam War, all the wars, Iraq and Afghanistan and whatever. So there's a lot of veterans out there. We have a huge military, and we have a lot of veterans. So they looked, everyone's saying, well, COVID's over, well, it's not over. It's here to stay. And it's particularly devastating in older people. So they looked in this study of veterans, those 75 years of age and older. People are living longer these days, or somewhat anyway. And they look at 75 and older and those with comorbidities. And they looked at the health records of 1 million veterans. I mean, this is a million people. There's a lot of states that don't even have a million people. Anyway, they looked at cardiovascular death associated with COVID. In the vaccinated people, the death rate from COVID was 60% less if they were vaccinated for COVID compared to those that were not. And stroke was decreased by 30%. And hospitalization from heart failure, which is, if you get hospitalized for heart failure, this is really serious. All right. You're one of the sickest people in the hospital. That was reduced by 40%. Now, is it just unique to this population? No. There's been studies around the world. There was an English study in 2022. It showed a very similar thing, and there's been other studies as well. They're seeing this massive in these older populations, especially if they have any underlying heart disease in particular. These vaccines are really life-saving. I mean, this is very powerful data because the study is so big. So if anyone says I don't need a COVID vaccine and they're older, I'm sorry, they're wrong.
And very, very similar findings have been released about the flu vaccine as well. Again, a retrospective look at over 23 studies. Can you tell us the data?
Yeah, so this is another million people. It's actually 1.1 million people were studied. And this study from 23 different studies, and they looked at it. It was published in the American Journal of Cardiology, which is a very, very respectable medical journal, found that patients with ischemic heart disease, which is the most common heart disease, or heart failure, who received the regular old flu shot, had a decreased risk of cardiovascular mortality, from the heart disease, and what they say all-cause mortality, death from any particular reason. They looked at both of those. And they found in this 1.1 million people that if they had the flu vaccine that year, all-cause mortality was down by 28% and cardiovascular mortality by 23%. Those are big numbers. And just showing that the flu vaccine, particularly in very vulnerable people with underlying heart disease, which is the number one killer of people in the United States, really, really helps. So get your flu shot, get your COVID shot every year, and stay healthy.
Absolutely. And you touched earlier on with the Ebola case about how stopping infections early and hopping on top of outbreaks before they spread too far is incredibly important.
Very important.
Unfortunately, we've not been able to follow through with that with the measles here in the United States. More
No,
cases this week.
that's measles is here to stay, unfortunately. Measles is the most contagious disease known to man. And as soon as that vaccination rate drops below 95%, maybe 93%, it gets out of control. So we are below 93% now. And it's, of course, not even across the country. There are some places where it's very low and some places that it's actually good. The only trouble because there's so much movement of people, even in places where everyone is vaccinated, there's always somebody that can't take the vaccine or has an allergic reaction, whatever, they can't take the vaccine. They're at risk now because people come from regions that are not vaccinated. They come in and they spread it, and they can cause a lot of trouble. So, there's a new outbreak now, and it's all around the United States. This is not a political thing. All right. Recent outbreak is in Virginia. 121 cases this year and 10 new cases in the past week, 34 in the week before. It's centered around Buckingham County, Virginia. And Pennsylvania also had 65 cases, and it's all driven by these unvaccinated people.
Like you said, infectious disease does not respect boundaries, it does not respect borders or political affiliations. It just spreads. and vaccination is the best way to prevent yourself from
Yeah.
getting the measles. Our final story today is a botulism outbreak linked to baby formula. Seems serious. Can you tell us about it?
Yeah. Nara Organics this is the company, makes a baby formula. Um, and it's called Whole Milk Organic Powdered Infant Formula. They sell it at Target, among other places. Three babies, ages 2 to 5 years old in California, Pennsylvania, and Washington, developed infant botulism and were hospitalized. So botulism occurs when the immature infant guts are colonized by botulinum-producing bacterial spores, and that cause symptoms like constipation, poor feeding, droopy eyelids. They get sort of paralyzed. And the only treatment is supportive. IV medication derived from plasma of immunized donors can be given that can neutralize the toxin. And parents who have this formula on their shelf should stop using it, and should immediately photograph the can and record the lot number, and watch for symptoms for at least a month before discarding it. You can tell your public health authorities.
Mhm. Well, thank you so much, Dr. Murphy, for the updates and keeping us up to date on all that we need to know in public health this week.
Well, thank you, Katie, and have a great weekend.
Thank you. And thank you all for joining us this week. We hope to see you back next week. As always, any questions or comments are welcome down below. Have a nice weekend.